When it comes to your health, all medical experts will tell you this. They'll say, be proactive, get ahead of it. And that's what we're going to talk about today. Floyd Memorial Hospital, the Women's Imaging Center, have a couple of experts to talk about mammography and mammograms. This is something very important, ladies, and I think this is information you will find very valuable. With me now, Sarah Leese, who is the radiology manager. Sarah, welcome to the show.
Thank you.
And Jill Van Fossen West. Did I get that right, Jill?
You got it right.
All right, she is the imaging supervisor. This is neat because when it comes to medical advancements, what I have found, and I think, Sarah, you would say this is true, is the better the technology, maybe the better outcome, correct?
It definitely helps in the outcome. So the more technology and the more options that we have, the more it helps that radiologist and helps the doctors to find those cancers at an early stage. So any extra tool in the tool belt helps.
All right, so let's cut to the chase here, Jill. How are 3D mammograms better and different than 2D imaging, 2D mammograms?
I'll say it in layman's terms. When you come in for 2D, it's the standard of care right now, and it's like looking at a book. You look at the cover of the book, and you just see, the top cover. With 3D, what you're going to do is you're going to flip through the pages, and by flipping through the pages, the radiologist is going to be able to see slice by slice. So what helps is if there's something there, they'll be able to determine if it's actually density or if it's just overlapping breast tissue or if there's anything actually within the breast.
Interesting. Now I've read conflicting information. Because I'm a husband and concerned about my wife's health, and she has had a little bit of breast cancer in her family history, I'm always concerned, and so I'm wondering, what is the threshold? What is the age group? Who should get a mammogram?
It's recommended that anybody over 40 starts having mammograms annually. If you've had a mother that's had breast cancer, let's say she's had it at 45, then her daughter would want to start her mammograms at 35, 10 years prior to her diagnosis, or at the age of 40, whichever comes first. So it's open for every woman. 3D mammography is geared for those women that have dense breasts, or the women that have a high risk. They have a lot of breast cancer in their family. The dense breast, it's harder to see when you have that whole picture, but if you're looking at it slice by slice, then you can actually see through that density to look for those cancers.
Okay, interesting. Jill, now, so from what I understand, 3D imaging gives you biopsy capabilities. What does that mean when you say this will give us biopsy capabilities?
Well, you can have different type of biopsies done. When you have your mammogram, if they do find something in the breast, like calcifications, we have what we call a stereotactic biopsy. But now with this 3D, we actually have a unit that will be attached right to the 3D unit that we have. And so if you came in and they found something in your breast with 3D mammography and they couldn't see it on 2D, we're going to be the only hospital within 100 miles or so that is going to have the capabilities of being able to go in and biopsy it with a 3D machine.
If you're talking to someone and they ask you the very simple question of, okay, I've had 2D done. Should I go ahead and have 3D? Do you think it's that big of a difference to whereas if someone has had 2D imaging, to go ahead and go 3D imaging, depending on what, their history, their likelihood of developing breast cancer?
That's correct. So at this point, 3D hasn't replaced 2D. 2D is still the gold standard of getting your mammogram, and it's definitely better than not doing anything at all. What 3D does is it gives them that extra tool, that extra help to look through, just like there's other options such as breast ultrasound or MRI of the breast. Those are other tools that help the radiologist find those cancers. So 3D is an extra tool at this point that's helping those radiologists find the cancers. At this point, it's not replacing. 2D is still the standard.
So, Jill, when we talk about breast cancer and breast cancer detection, it goes back to the being proactive. It's all about detection early.
Absolutely.
So, in that regard, detecting earlier than maybe 2D imaging, is 3D imaging more effective?
As of right now, they are saying yes, that it does detect smaller breast cancers earlier, and it's just, I think it's better all, for the heterogeneously dense and dense breast tissue.
I'm curious, Jill, because you all have seen quite a few patients. Obviously, you definitely, as an expert in the field, you would know the difference between the two here. So have you seen times when you go, okay, 3D imaging did make a difference in this particular case? And both of you weigh in. I see you saying, yeah. I see Jill going, yes. Sarah, Jill, go ahead.
I use it because I work with patients. I'm a working supervisor, so I do get to see this quite often. And we're not having as many callbacks because of it. Again, because with the flipping through the pages or looking through the slices, something that might have looked like something like a nodule on a 2D does not look like that on the 3D. So you don't have to call them back for extra pictures, or we can see it better and we do find something.
It's almost like a CT or an MRI that you would, when you refer to as slices. So it's looking, that 2D is the entire breast from the top to the bottom, all in one picture. Where that 3D slice, that is going down through the breast, just like if you would have a loaf of bread that you would cut slices and look at an individual slice. So there are, where 2D, the standard is 4 pictures. The 3D, there are multiples. There's up to hundreds of pictures that they're actually using to look at the breast. So.
With that being said, you still only take 4 pictures total, 2 in one view and 2 in another. But that's when you get the slices with the 3D. So that gives you all the slices all together.
You know, not that I have this conversation every day, but every time I talk to a woman about getting breast exams and mammograms, they talk about how painful it is. So where is technology coming from there? Help me out. I see Joe going, no. Is that not the case?
Well, I really think it's the individual a lot of times, because we get people in every day and it doesn't bother them. But you do have people that just have denser breast tissue, they have more sensitive breasts, that can make it a little bit more uncomfortable. But the 3D is doing the same type of compression as you would with the 2D. But I think it really depends on the person.
Okay, there we go.